Hello, I'm Christopher Robertson. I'm also at the School of Law and pleased to be here to talk to you about robophobia in medicine. And I want to start with asking you a question. What if you had a deadly disease? I'm sorry, it's leukemia, for example. And it turns out that your doctor tells you there's actually various kinds of leukemia and various treatment plans, and you really need a specific diagnosis and a treatment plan designed for you. And there's two ways we can get you what you need. One is you could visit a hematologist oncologist, which is a specialist physician who does this sort of work. Or you could go to a special AI system called MedX, which has been built, proprietary technology with tens of thousands of data points specifically designed to diagnose this particular kind of cancer. Your insurance covers either one. Which one would you choose? You can only have one on your insurance. Let me see your hands. Which one would you choose? How many of you would choose the human specialist physician to do this work? How many of you would choose the specialized AI system? I'm seeing about a 70-30 split here. And this is not unlike what we found in our nationally representative sample of about 2,700 Americans. The majority under these circumstances, actually more richly described in the context of more than a 5-minute speech, they actually preferred the human oncologist, hematologist, as you might expect. But what if we, in a randomized experiment, we ask half the respondents this version where we add, your doctor tells you that based on scientific studies in leading journals, the AI system is proven more accurate at diagnosing compared to even the human specialized physicians. Now, how many of you would choose the human specialized physician? 2 or 3. How many of you would choose the AI system? We're up to about 98%, I think. Unfortunately, our population-based sample didn't get there. 4 out of 10 continued to insist on they want the human physician, even if it's scientifically proven to be less accurate. And arguably, we are moving into this space, not generally, but in case by case, not the large language models, but the specific ones designed to do specific medical things are increasingly outperforming human physicians. But the risk is that people will resist actually using them. And so this is what's known in the literature as AI aversion, or more colorfully, robophobia. And our research has been studying this. And first of all, we have to recognize it is a potential health risk. If you're averse to using tools that can save your life, we'll end up with mortality and morbidity. And so it's a problem to be studied, a problem to be solved. Unfortunately, our research suggests that it's a pretty robust phenomenon. We studied it across a range of populations and also across a range of manipulations, where we tried to put the AI in a favorable light, in a context that should drive more people to it, showing that it's established, showing that a physician will incorporate it into their own advice, showing that it'll be tailored to your specific circumstances, showing that unlike humans, it's actually unbiased racially or lacks financial conflicts of interest. But across scenario after scenario, we were sort of unable to beat it down completely. We also found that it's especially strong for Americans that are more conservative, more religious, older, and in particularly Black Americans, which we designed the study to examine a range of diverse populations. We did find that it can be mitigated somewhat, not fully solved, though, if you, first of all, educate people. We did find the more education you have, the more open you are to AI. We also found that you can nudge people towards it by describing it as the easy choice, the automatic choice, the default choice, the one the physician recommends. We've also found that if you make it a listening user experience, that you'll be heard, that your own experience will be respected, that supports AI adoption. But we also found it's a function of trust in AI companies more generally, which suggests a collective action problem. If OpenAI or Microsoft or Tesla screws it up, it could actually affect adoption in a range of other contexts as well. And but the bottom line is we found that no matter what we did, many patients are still averse to using AI in their own healthcare. And it raises questions for a bioethicist or a legal scholar as to whether the use of AI should be considered material to the healthcare decision, whether it should be part of the informed consent process, even if giving patients the choice may cause some of them to make suboptimal choices and insist on human decision-making, even when it's no longer ideal. Thank you.